Welcome back. My next guest is Dr. Brandon Devers, who is an orthopedic surgeon with Lexington Clinic. Your specialty is predominantly hand, upper extremity. Welcome.
That's great. Thank you. Thanks for having me.
So, I mentioned when we first started hand pain. What are some common causes of hand pain?
Right. So some of the most common causes of hand pain we see nerve compression, such as carpal tunnel syndrome, various tendonitis conditions, and then arthritis is a big one as well.
Okay. Now you mentioned arthritis, but a lot of people say I've got arthritis in my hand. Are there certain symptoms of certain things you've got it?
Right. So in general, we talk about arthritis. It tends to be more stiff in the mornings. As you wake up and as you get going, the joints kind of loosen up, tends to respond fairly well to anti-inflammatory medicine, causes stiffness, pain with motion and use, and then there's certain joints in the hand that are just more predisposed to developing arthritis than others.
So are there different causes of arthritis that cause your hands to?
Right. So in general, the most common cause is just degenerative or osteoarthritis, what we just call garden variety arthritis, same thing you get in your knees, hips, shoulders, hands. You can also get more systemic causes, autoimmune causes such as rheumatoid arthritis, psoriasis, lupus. These things can cause a more systemically mediated arthritis, but in general, we're still mostly dealing with garden variety degenerative or osteoarthritis.
Now, when you mention that, is that activity or use related?
Yes, I tell people we only have so many treads on the tire, right? So some of it's activity, just a life well lived. We use your hands. We want people to use their hands, but over time those joints can wear out. And some of it's genetic mediated. We know that there's predispositions genetically and biologically to arthritis. So some patients with a strong family history might just be more prone to it than others.
So treatment, what do you do?
All right, so when I see a patient for arthritis, we go over their x-ray, I show them, kind of explain what it is, and I look at them and I say, listen, I'll never put up an x-ray and tell you, oh, here's arthritis, here's what you have to do. Tell patients with arthritis, you're the captain of the ship, I'm along for the ride. I'm going to give you options and you're always going to tell me what you want to do. Now, we always usually suggest starting with conservative treatment, especially if there's not been any conservative management instituted. So we start conservatively, intermittent bracing, therapy, anti-inflammatory medicine, topical creams, and then I'd say corticosteroid injections are one of the mainstay of conservative treatment. And I tell patients, as long as that kind of blend of conservative management is working, we can essentially do that forever. Eventually, one day, it might not be as effective for the duration that they want or to the level that they want. And I say, you'll know. One day I'll come in the room and I'll sit down and you'll look at me and say, it's time to do something else.
And that something else is surgery, and you do a new procedure, relatively new, at least new to me, called CMC, or carpal metacarpal denervation. Did I get that right?
You got it right. So the thumb CMC joint, and I tell patients, I kind of call it the C sign. So if you are having pain in this area of the thumb, it's almost always related to thumb arthritis. Tends to be worse with pinching, gripping, twisting activities. So the traditional procedure for this is we remove the bone called the trapezium. It's called a trapeziectomy, and then most surgeons use a tendon or a tendon slip to either kind of resuspend the thumb and fill in that space. Some people use an implant. But the traditional trapeziectomy surgery for treatment of thumb arthritis has been around for forever, and everyone has their own little variety on how they do it, and it works great. I always tell patients, if you have it on both hands, they usually come back and ask for it on the other. The main downside of the traditional surgery is you're looking at least 12 weeks of some restrictions with that hand before we can begin progressing with your strength and function. I'm always interested in looking for more minimally invasive techniques or surgical options that might help get patients back to their activity level faster. So when I was at one of our hand surgery meetings about 5 years ago, I came across this topic of thumb CMC denervation, or carpal metacarpal joint denervation. We've been doing denervation procedures for wrist arthritis for forever, so intuitively it made sense to me, but anytime you're trying to take on a new procedure, you're a little bit reluctant or a little bit hesitant. So fortunately at that time, I was working with a scrub tech in my surgery office who I had been treating since she was in her early 40s for pretty bad arthritis, and she was 47. The injections just weren't working. I was like, man, you're pretty young. I really don't want to do this bigger surgery on you and risk long-term maybe it wearing out, and she really didn't want to take 12 weeks off from work. So we got to talking about this procedure, and she was actually my first patient that I was able to do it on. She was back to work full-time as an orthopedic scrub tech in 3 weeks, and I talked to her recently. She's been over 4 years from the procedure, still no pain. So kind of made me a believer, and now we've expanded numbers from there.
Well, that's great information. That's great work you do, and thank you for coming in and telling us about it. And if you have thumb pain, you may be a candidate and can see Dr. Brandon Devers at the Lexington Clinic. We'll be right back.